Hi, my name is Candy Barnes. I'd like to thank you for joining me today. I'm doing this video for my UALR Nursing Ethics and Legalities course, and I'll be making several references today to terms that come from our textbook, Nursing Ethics, Butts and Rich, 2008. As nurses, we have a duty to maintain patient safety. Today I'm going to look at a case study that presents an ethical or moral dilemma, and then use the moral decision-making process to walk through that dilemma from start to finish. Imagine with me that you're an ICU nurse working in a critical care unit where the patient-nurse ratio is 1-to-1. Because of the recession, hospitals have started to tighten the economical belt. And that means that sometimes we ask nurses to take on more of a patient load than they think is necessary. You're working, you have one patient who's critically ill, the patient beside you is also critically ill and has their own nurse. The housing supervisor calls and asks your unit coordinator to go down a nurse later in the shift. This presents us with a dilemma. So let's walk through that case study. Moral. M. Massage the dilemma. Our dilemma is that as nurses, we have a duty of non-maleficence, to do no harm. We are the patient's advocate. We must ensure their safety and provide the highest quality of care possible. But we also have to meet regulations that the hospital sets for us, and fiscal budgets have to be met. Oh, we're going to outline our options. You could choose not to voice a concern and go ahead and lose that nurse, take on an extra patient, and see how things end up for the rest of the shift. 2, you could choose to voice your concern, telling your nurse coordinator that you do not feel that this is in the best interest of patient safety, and asking, instead of sending a nurse home, could we send a tech home? 3, you could choose to voice your concern and concede that if a nurse must be sent home, can a tech be brought into the room to help with some of the extra duties, perhaps charting and running errands for that nurse who's going to be very busy. R, resolve the dilemma. You talk to your unit coordinator and decide that the best option for patient safety is to retain 2 nurses and see if a tech can be sent home in their place. A, act by applying the options. You call the house supervisor, tell them what your plan is, and see if they go for the idea. In this case scenario, the housing supervisor agrees. You're able to send the tech home, retain the 2 nurses. L, look back and evaluate. As the bedside nurse, you believe that you have been a successful patient advocate, that you have fought for patient safety, and that the hospital guidelines have still been met. Thanks for watching.